Welcome to the recorded version of the Grantmakers and Aging web seminar, Why Create an Age-Friendly Community? Evidence of Health and Community Improvements from Around the U.S., featuring Dorian of the New York Academy of Medicine, Kate Clark, Planner for Policy and Program Development at the Philadelphia Corporation for Aging, Alan Glicksman, Director of Research and Evaluation at the Philadelphia Corporation for Aging, Dana Bradley, Professor of Public Health and Director of the Center for Gerontology at Western Kentucky University, Mary Blumberg, Program Manager for Strategic Planning and Development for the Atlanta Regional Commission, and John Feather, CEO of Grantmakers and Aging, from May 13, 2014. This event was made possible by a partnership between Grantmakers and Aging, the John A. Hartford Foundation, the New York Academy of Medicine, the Community Agenda Initiative, and the Pfizer Foundation. Technical and production support is provided by the American Society on Aging.
Thanks, Steve, and thanks to all of you for joining us today. As Steve told you, our session today is once again on the topic of age-friendly communities, and today we're turning to the issue of what evidence do we have at this point about improvements to the health and community around the United States from age-friendly communities work. Once again, my name is John Feather. I'm the CEO of Grantmakers and Aging. Before we begin, I want to thank those whose support is making today's webinar available free of charge to our audience. The John A. Hartford Foundation of New York provides continuing support for this series. The New York Academy of Medicine is a co-sponsor today, as is the Community Agenda Initiative and the Pfizer Foundation. We also want to thank the expert team at the American Society on Aging for providing technical and production support for this series. Age-friendly communities have had a significant impact in making America a better, more prepared place to grow up and to grow older. Today, we are bringing together this informative session to focus on age-friendly community initiatives from around the United States that have demonstrated improvements in health, quality of life, and cost savings. Our discussion will also include metrics and evaluation tools to demonstrate outcomes to different stakeholders. Helping us to understand these issues are speakers with very deep experience in the challenges and opportunities on these issues from around the country. With us today, we have Dorian from the New York Academy of Medicine, Kate Clark and Alan Glicksman, both from the Philadelphia Corporation on Aging, Dana Bradley, the Director of the Gerontology Center at Western Kentucky University in Bowling Green, and Mary Blumberg from the Atlanta Regional Commission in Atlanta, Georgia. Welcome to you all. Dory, let's start with you. Could you give us a few introductory comments about how all of these pieces fit together and what we're hoping to learn from today's session?
Sure. Thank you so much, John. So again, I'm Dori Block. I work at the New York Academy of Medicine in New York City, and we work in partnership with the Office of the Mayor and the City Council in New York on the Age-Friendly New York City initiative. And we helped organize today's session and are a co-sponsor together with GIA. And today's webinar is we're really hoping that we can begin to move the conversation beyond the concept of why an age-friendly community is valuable and how to implement it in various places, and really begin to think about evaluation and measuring outcomes. And age-friendly communities as a name connected to the World Health Organization and as a network have been around for the past 8 years. And there's really pressure coming from different places, from academics who are doing research on the model, from some popular press and mainstream media, to the practitioners who are actually implementing these models, to begin thinking about age-friendly communities and how do we demonstrate their impact? How do we show the incredible health improvements that some of these initiatives are creating? How do we show the value to community development and quality of life? And how do we also prove the economic benefit to communities so more communities will take it on and so that people understand that their investments are well spent? I wanted to just quickly share in New York City that we have found it to be very challenging to measure any kind of city-level change and be able to actually attribute it to the age-friendly initiative. And yet we have taken great care to evaluate specific initiatives. So we have an initiative called Safe Streets for Seniors, where more than 600 street intersections in New York City have seen different kinds of improvements and redesign. And specifically, we were focusing in areas where there were the highest incidence of pedestrian injuries and fatalities. And over several years of the program's work, we have now seen a 21% reduction in pedestrian injuries and fatalities for the older adult population. We've seen as much as a 90% decrease at specific intersections. And we've also heard anecdotally from older people about having less of a fear of going outside and feeling more able to access resources in their community because they feel like it's safer to cross the street. Some of these redesign elements include just changing the painted lines on the street, changing the timing of the lights so people have more time to cross, and then some slightly more costly improvements like building new pedestrian islands. Another initiative that we evaluated was around having special senior swim hours at public pools. Many older people told us they would never feel comfortable visiting a public pool. In New York City, they are packed and filled with children and can feel unsafe to people. And when we had these special hours in the morning, which were created through a grassroots effort, we also evaluated when older people participated in the hours, how it affected their health. And we found that through pre- and post-fitness testing, that 80% of older people who participated saw an improved health in several categories. We also have a local business initiative where we work with local retail businesses to think about how they can better serve and attract older customers, everything from making sure people can reach things on shelves to allowing people to access restrooms, have seating, have senior discounts or special events that would attract older people. And we did a very small research study comparing businesses who had age-friendly features to those who did not. So one florist to another florist, a pet store that had age-friendly features and one that didn't. And we were able to show that customer cash receipts were actually higher in the businesses that had age-friendly characteristics to them. And so that's just some of our early results coming out, but we're very excited about this conversation. There's a international conversation being had in this area. The Kobe Center in Japan is working together with the World Health Organization and people from around the world to try to come up with some indicators that can be used at a community level around the world to measure the effectiveness of age-friendly communities. And they're about half-baked at this point. So I'm very much looking forward to today's discussion and excited to hear about the work that's happening in different places around the U.S.
Thanks, Dory. New York has obviously been one of the leaders in this movement for a long time, and we appreciate all that you have done. Let's bring in Kate and Alan at this point to talk to us about the experience in the Philadelphia area. Kate?
Sure. Hi, everybody. My name is Kate Clark, and I'm Planner for Policy and Program Development at Philadelphia Corporation for Aging. And I'm going to give a brief overview of the agency's Age-Friendly Philadelphia effort, and then Dr. Alan Glicksman is our Director of Research here at PCA, and I'm sitting here with him. And he will give a description of our research and evaluation efforts around the agenda. So just to give you a little background on where we work, Philadelphia Corporation for Aging is the area agency on aging for Philadelphia. And if you're not familiar with the AAAs, as they're called, every county in the U.S. is served by one, and they really vary in size and in scope, but they are great age-friendly partners. Yes, of course, that's us. But yeah, so we're a 700-person operation. We're primarily funded by the Older Americans Act and the Pennsylvania State Lottery. And with this money, we fund senior centers, adult daycare, Meals on Wheels, transportation, and we also run programs. Slide, please. Sorry. We also run programs such as long-term care services and home modifications. And we have a planning department, which is where Alan and I work, and where our Age-Friendly Philadelphia effort lives. Slide. So PCA's Age-Friendly agenda was initiated in the beginning of 2009 to build on our work to help older adults remain in their neighborhoods for as long as possible, and to address a lot of the obstacles to aging in community. And here on this slide, you can see some photos with some of these obstacles having to do with walkability and public transportation and housing. Slide. And so we define an age-friendly city as one that is committed to improving both the physical and the social environment that surrounds older adults in order to facilitate independence and neighborhood cohesion. Slide. So because as a AAA we don't make changes to the built environment, and because our program doesn't have a budget, it's really just staff time, we're really trying to facilitate innovative collaborations and policies to help all of our neighborhoods become more supportive of older adults. And so to do this, we've been working with organizations outside of the Aging Network to help them to integrate seniors into their plans and policies and programs. And a lot of that's because we found that many organizations outside of the traditional Aging Network are not really focused on seniors, but more so on kids and the creative class and families. And so that's a really pretty key component of our work, which is this idea of catalyzing versus managing projects. And there are 4 other key features that I'm going to point out to you. Slide. So a cross-disciplinary approach we found is really necessary to accomplish our goals. And this means working with organizations from a variety of disciplines and really learning each other's languages. Slide. And the second is that we've been using the EPA, the United States EPA Aging Initiative model, Environmental Protection Agency. They have an aging initiative. Like many of us, many communities are working on age-friendly efforts, and there are a variety of frameworks out there. We decided to use the EPA model because we really like the way that it integrates principles from social services and public health, and in those worlds, with the world of urban planning and design. And Alan's going to talk to you more about that model and evaluating it. And I just wanted to note that last year, our city, the city of Philadelphia, applied and was accepted into World Health Organization's Age-Friendly Communities program, which is very exciting. Slide. So the third key feature is that we are working with the future leaders of Philadelphia to help them become ambassadors for aging issues. Gen Philly is an award-winning network of over 400 emerging leaders throughout the city, mostly in their 20s and 30s, who work in a variety of fields and who are taking a personal and professional interest in aging issues. Slide. And we're asking our members to think about the type of city in which they themselves want to grow older while helping out the current population of seniors. And this slide just shows the different types of professionals that are involved in our group. Slide. We're trying to show our members that there's a competitive professional advantage that results from incorporating knowledge about older adults into their skill set. And we do that through social media and through events. And as you can see, we're really trying to choose event themes that are appealing to emerging leaders. And we think that Gen Philly has been a great way to sustain our age-friendly effort, and actually just published an article on replicating the model. So if you're interested, please do email me after this presentation. It's in the Journal of Social Policy and Aging. Slide. So the fourth key feature is that we are really looking for existing opportunities for the effort instead of jumpstarting our own projects or reinventing the wheel. Slide. So for example, with our Age-Friendly Parks project, we realized that citywide seniors were not visiting parks. So we worked with a bunch of Gen Philly members who work in organizations who design and renovate our green spaces to create the Age-Friendly Parks checklist, which is now being used in a bunch of renovations, including a big $5 million renovation in West Fairmount Park. And from this effort, we've also really learned a lot more about targeted programming for seniors in parks. And Alan's going to talk a little bit more about that in our evaluation of the effort. And we're also now reaching out to park stewardship groups to help out with their local parks. Slide. Here's another example. A few years ago, we realized that 65% of older Philadelphians reported being obese or overweight. And at that time, there were a number of efforts citywide to increase access to fresh food, but many were not really dealing with seniors specifically. So through Gen Philly, we brought together professionals around this issue, and we decided to facilitate projects related to community vegetable gardens at senior centers and senior housing complexes. We created a toolkit. We worked with the EPA on a fact sheet on building elder-friendly gardens. We created a listserv to bring professionals together around the topic on a regular basis. And now about 3/4 of our senior centers have gardening activities, which is quite exciting. slide. Another example has to do with housing. Through Age Friendly Philadelphia, we facilitated the Philadelphia Seniors and Housing Interest Group, which brings together developers, community advocates, and aging network professionals around the need for more affordable, accessible housing for seniors. And we've looked at a lot of issues. The ones where we've had the most impact are those having to do with the city's new zoning code around accessory dwelling units, and also creating a demand for more visitable, accessible, new single-family construction. And my last slide. Lastly, another existing opportunity has to do with the National Prevention Strategy. I am an Atlantic Philanthropies Health and Aging Policy Fellow with the Office of the Surgeon General, and have been looking at ways to integrate aging into efforts related around the strategy. And if you're not familiar with the National Prevention Strategy, it was created through the Affordable Care Act as our nation's plan for better health and wellness through a multidisciplinary and evidence-based approach. And so now here at PCI, we're starting to think more about how age-friendly really fits into the work of this national plan and how we can use it moving forward. And so with that, I will hand it over to Alan.
As Kate said, my name is Alan Glicksman. I'm the Director of Research and Evaluation at PCA, and much of our research work is directed at efforts to modify the environment that are part of the age-friendly effort. Slide. What I want to talk a little bit about are the different ways research and evaluation can aid in an age-friendly effort, in addition to the ones that are obvious. There are 5 specific areas. One, is there evidence that the proposed intervention will have the desired effect? Before you do anything, is there any chance that it's going to make a difference? 2, greater detail on specific areas of need and characteristics that might be affected by an intervention. So look at a particular intervention and see whether it may have an effect. 3, establish evaluation procedures in advance. So evaluation is part of the planning and execution of the program. 4, collect data on why older adults do or do not participate in the program. Their reasons for participation may be different than the intention of the program. And finally, evaluate efficacy. It can be important to know not just whether the intervention worked, but why it worked or why it didn't work, what were the unintended consequences, because there always are, and planning for the next steps. Next slide. So I'm just going to go through quickly examples for each of these. First, for the determining the potential impact of testing the EPA model that Kate mentioned, we set up a model to ask whether the 4 areas of the EPA initiative, social capital, housing, transportation, and availability of healthy food, are related to desirable outcomes, including better self-rated physical health, better self-rated mental health, being physically active. Even when you control for the major predictors for those outcomes, poverty status, minority status, and functional health. Slide. And what we found was that there was a relationship, and in fact the 4 elements in the EPA model had an effect on health outcomes and on whether a person desired to remain in their own home, even when controlling for poverty, minority status, and functional health. So it meant it was worth going ahead with that. Slide. Reporting on need, looking at public transportation. Now we take one of those areas, we could focus on it, and we looked at difficulty in accessing transportation and distance to hospitals, since many older adults go use hospitals for testing, for specialty care. We found using GIS, using Geographic Information System, that's mapping, and taking it into statistics, that in fact distance was not related to difficulty, it was poverty. Poverty predicted whether there were problems in accessing transportation to seeing doctor appointments. That's an important insight. Slide. Establishing evaluation procedures. This is what we do with the age-friendly parks effort. We designed a tool, and then we took it out and did focus groups. Slide. And asked people about why they use parks, what of the items on what we thought were important, they would think are most important in terms of whether they use a park or not. We found what they wanted most was safety, which could have to do with other people in the park, cars, bicycles, and bathrooms. And the other thing we learned, which we didn't expect, was they much prefer to go in groups, partly out of safety, but partly because it reminded them of childhood family gatherings in parks. And that was an important piece of information in terms of determining what programs should be completed in order to encourage more park use. Slide. Why do older adults participate? And as Kate mentioned, community gardens and access to food is an issue, and 67% of Philadelphia's elderly report being obese or overweight. Slide. But when we evaluated, we found older adults did not garden because of the health benefit or because of the exercise, but because of the mental emotional benefit. It said just forget all their troubles. It also created a situation where the older adult was the expert. In many cases, older adults felt they were cared for but not respected. Many of them know a great deal about gardening, and so when teenagers were brought in, they could be the mentor. Those were the reasons people garden, which were different than our goals, but it explained how you get older people to be more involved in gardening. Slide. Finally, we got a grant from the National Institutes of Health to examine walkability's impact on senior health. And what we found was that there were 3 different pieces to walkability that affected health behaviors: access to amenities, distressed neighborhoods, and highly residential neighborhoods with little mixed use, which means that there were no place to buy fruits and vegetables. So that there are different aspects to this age-friendly model, and they're related to different kinds of health outcomes. It's not a one-size-fits-all. Slide. And we also discovered that in very distressed neighborhoods where there was a mural, which is a relatively modest intervention, health was reported to be better. Now, we're going to follow up with that and see if there's more of a causal relationship there, but it suggests that more modest interventions in more distressed neighborhoods may be effective. That same intervention in a wealthier neighborhood had no effect. So you may get more bang for your buck, so to speak, by doing more modest interventions in the more distressed neighborhoods. And we also use that information, and this is something we borrowed from our friends at Atlanta Regional Commission, the idea of a design charrette, which by using mapping again, which has been critical to our work, we were able to share our findings with the community, with older adults, with all kinds of people, and talk about how the results from our analyses might allow the community to do better planning in terms of better access for older adults to streets and neighborhoods and amenities in their neighborhood. And so that's a general introduction to how research methods, including mapping, can benefit age-friendly efforts.
Thank you so much, Kate and Ellen. That's a very useful introduction to those issues and also to some of the great work that's being done in Philadelphia. Dana, at this point, can we have you come in and talk to us a little bit about what's going on in Kentucky?
Great. Well, hi. This is Dana Bradley. I'm a professor of public health and director of the Center for Gerontology at Western Kentucky University. And so it's a pleasure to speak with all of you. And Bowling Green, Kentucky is very different from both New York City and Philadelphia. Can we have the next slide? It is situated about an hour north of Nashville, and many of our listeners might have heard of Bowling Green. It is the only place in the world where Corvettes are manufactured. And most recently, 8 of those prized Corvettes disappeared into a massive sinkhole. They have been since recovered, or pieces of them. But it sort of put Bowling Green on the map. The other thing that has been very exciting for us has been being involved with the Age-Friendly Cities and Communities Network through the World Health Organization. And the city of Bowling Green joined that network 2 years ago as one of the original 7 cities in the United States. And it is the 3rd largest city in the Commonwealth of Kentucky, but it is very rural in nature, and this is very important. So like research, like planning and politics, everything's local. And here our population is around 60,000, but that includes a large group of students that in and out migrate with the academic year. But it is a city that is surrounded by a 12-county area that's very, very rural. So Bowling Green is the nexus for a lot of economic development within the region. It is extremely diverse. The 3rd most prevalent language spoken here is Bosnian. So we have been a long history of being a refugee resettlement center. So while it does have the characteristics of a college and university town, it draws from a fairly large international population, strong central business district, but the university itself is one of the predominant economic drivers, and it's the predominant landowner as well. So it kind of drives at least the perception of things that are happening within the city of Bowling Green. Next slide, please. So one of the most important things that we did was create a research infrastructure that would be self-sustaining regardless of our internal or external funding, and really focused on the strength of our volunteer stakeholders. And so it's a little bit different, again, from the New York City or the Philadelphia model in that it's driven both by senior volunteers and by student researchers. So the partnership relies on the City of Bowling Green, the office of its mayor, who is a strong supporter of this project, and the Office of Neighborhood Services Division, as well as, of course, the Office of the President and our Vice President for Research at Western Kentucky University. Key to this infrastructure has been the development of 2 successive cohorts of volunteer leaders. So in Philadelphia, they've been really working with developing their next generation of leaders. Here we focused on putting tools in place and in the hands of older adults as volunteer leaders and researchers. And so with funding primarily through AARP Kentucky and the City of Bowling Green, we've trained just over 50 older adults as citizen experts. And so they know, in a week-long course, they know more about the operations of the City of Bowling Green than just about any other citizen in town, which has been a very exciting thing to watch. And as part of that, 12 of those volunteers moved forward and became facilitators that we've used in a series of neighborhood conversations. We've also used our own students here, and again, students are an integral part of what we do, and we're very fortunate to have the state's only honors college. And so these students all do research, and they've been involved in a 2-semester partnership with the research activities to go out and do field research. Next slide, please. So I want to talk a little bit about our baseline assessment that has helped drive the research agenda here. And we did this by really using, again, that volunteer group of seniors that also act as our steering committee, and they helped, through their facilitation, run 35 different community conversations. And so these weren't focus groups per se. For those of you who do that kind of research, they really were sort of a listening conversation where we asked the primary question, which was, what kind of community do you want to live in? And those conversations were transcribed and included most of the neighborhoods. So we were using a neighborhood-based approach. Included 5 different languages, and over 400 different stories were captured through this process. And then we used that information to look at our major issues, some challenges, and where really the strengths were within the community to move forward. Next slide, please. The primary issue, and the one that I want to talk about for the rest of my time here, stemmed from this feeling of being not connected to the community. And this came up in a number of ways, but it was cross-generational. So it was not just older adults saying, we don't feel connected, we don't feel safe, we don't feel seen. We saw that across the different ages that were participating in these conversations. And this sort of rose to the top as the number one issue that the steering group wanted to work on. And so from that, these group of seniors formed something they called a community calendar committee, and the average age there is currently 73. So again, this is volunteer-driven, supported through the Center for Gerontology here on the campus. And they decided to really focus on the strengths in the community. We have a wide variety of nonprofit organizations and activities that are available to people regardless of age or income, and 2 healthy healthcare systems and 2 public transit systems, which is somewhat unusual for a town this size. And the committee decided what they wanted to do was to really increase awareness, and they felt, and we supported this in terms of our own research, that if there was increased awareness of the kind of resources that were currently available, we thought we would see increased connections between older adults and the communities in which they were residing. Next slide, please. So like a good researcher and research team, we tested, we evaluate and refine. It's a continual process. And so this community calendar committee, this group of seniors, looked at multiple options, and we worked through a set of strategies to look at cost, access, and really asking, were the solutions being identified? Were they appropriate for the target population, which here is primarily older adults? And they came up with this idea of a one-page monthly calendar. They would highlight activities that were available in a public forum. So again, primarily free, without regard to membership in an association or a place of faith or a particular housing community. And they wanted it in a print format. And this was a very interesting set of conversations which we've documented, because initially we thought, and then we here would be researchers here at the university, that the most accessible format would be an online internet format. And the committee really wanted something that they could hold in their hands and put on their refrigerator with magnets. And so they tested this by over a 3-month period, handing out flyers at the Senior Day, which is a local once-a-month event at our local supermarket where people can get a discount. So if you show up on the Wednesday of the month, it's called Senior Day. And using surveys, they had a wide response saying that this was a good idea. And in fact, 95% surveyed liked it, and 75% liked the format, and suggested that it be distributed via a monthly newsletter. This is a monthly magazine that's available free of charge called the Soki Magazine for Southern Kentucky Magazine. So this committee itself found a funder, developed a proposal, and it's now being promoted in this monthly magazine, not only the calendar, but a newsletter, sort of a news about being older and in the age-friendly community that's being written by seniors. And the link actually to the calendar itself is online in the WKU Aging, our website. So it's sort of to save money and in terms of meeting the formatting of the publisher. Next slide, please. So a couple of other examples of things that have been that have specific outcomes that we've been doing in the past year and a half has been a neighborhood audit looking at walkability in built environments, and this is based on a pilot using graduate students and older volunteers. So they actually do this walkability assessment together and identify some weaknesses in the neighborhood, some strategies that could be implemented, and then do a follow-up where they're looking at, is there an increase in walking in the neighborhood? And that was one of our key outcome indicators. And we think that this process working through the neighborhoods, we hope to have 60% of them done by the end of 2014. Another thing that we've been working on is our annual Age-Friendly Awareness Award, following on the successes of New York City in terms of developing age friendliness. And we have a public competition with an awardee, which has been a business. And we have been using an undergraduate student to evaluate the criteria that are being used here in Bowling Green and to work with the committee on how to promote that. But just based on the last year, the awardee noticed we could document a 20% increase in foot traffic from the previous year. So that is a very important way to link this concept of awarding or highlighting what the community thinks is an age-friendly or age-aware business, that it has a positive outcome for the businesses. Something that the mayor of Bowling Green and my university president are particularly proud of. Bowling Green was just recently ranked one of the top 25 places to retire to in 2014 through Forbes retirement ranking. And yes, retirement, these rankings do matter to some people. And here, this was seen as a primary evidence of age friendliness being an economic driver. Next slide. And just to give you just a brief overview, these are our guiding principles that we have used throughout this process. and our primary focus here is the older adult in the equation is the expert, not the researchers here at the university. And we're really looking at identifying processes and outcomes that show that many of these changes could be low cost or no cost, and being very aware of strategies that will have a lifespan that goes beyond the project. So I'm going to conclude and pass it on. Thank you.
Thanks very much, Dana. Before we move on to our final presenter, I want to remind the audience that you can write in your questions for our presenters. Just open the question box that's at the right of your screen, and just go ahead and type your question now, and we'll be returning to those after our final presentation. So, Mary, why don't you talk to us about what's going on in Atlanta?
Okay, thank you, John. I'm Mary Blumberg, and I manage strategic planning and development for an Atlanta Regional Commission, working primarily with the Area Agency on Aging. Next slide. So that you learn a little bit about what ARC is, or the Atlanta Regional Commission, we have a very diverse portfolio. As I said, I'm in the Aging and Health Resources Division, which is the Area Agency on Aging, and I think Kate gave a very good explanation of what that is. But we also are the Regional Planning and Intergovernmental Coordination Agency for a 10-county area. And so we are made up of a lot of planners and some social workers in our division, but we look at a lot of different areas. Our wheelhouse is very diverse, and many of the built environment things that are important to age-friendly are things that we look at every day and work in and plan for. Next slide. This makes, I will say that being part of an area agency and a metropolitan planning agency is a bit of an advantage when you're working in the age-friendly world. There's probably about 30% of the area agencies in the country that are housed like we are. A look at the Atlanta region is that, as I said, our area is about 10 counties. We have over approximately 500,000 people, 65 and older. Lots of urban sprawl, and I think this picture is an example of how most people get around and gridlock every day here. And we have limited housing options other than single family in most of our rural and suburban neighborhoods. As a whole, we're not a very healthy area. Georgia tends to rank near the bottom on many health indicators. People don't get enough physical activity. They don't report eating many fruits and vegetables. Access to vaccinations and pneumonia and flu are very, very low. So we have a long way to go on reaching our health goals, and the way our built environment is now really doesn't support it. Next slide, please. Some of our goals for lifelong communities, which is what we call our age-friendly work here, is really not per se health specific, but they're things that do promote health, and it's really interrelated. We are definitely in the built environment and world trying to promote transportation and housing options. We want to improve the long-term care supports and services, access, options, and delivery, and that's a lot of what we're doing with the area agency and our everyday work with the Older Americans Act. And then we're also, because we are not one city but a region of over 70 cities, we get our work primarily done through other people and through the work that's done at the city and county level. So we have to create a climate that builds momentum and facilitates changing in funding. It's easy to get agreement when we talk about age-friendly cities and communities. Everybody thinks that's a good idea. But when we ask places to change their spending patterns, that's where the resistance comes in, or the no action. For instance, if you want a community to look at how they spend their transportation funds and move away from just only building highways to other modes of transit, that's a little bit harder thing to sell. So that's one of our goals, is to move in that area. Next slide, please. When we look at our outcomes, you will know that we're mainly looking at planning, and so we have outcomes that are dealt with our ARC 2040 plan. The region's comprehensive land use and transportation blueprint to sustain livability and prosperity is what this plan is, and it's actually created in our office with a lot of input from those cities and other stakeholders in the jurisdiction. We have had some success with our local cities adopting some of the more progressive age-friendly measures that are important for older adults and persons with disabilities. Next slide, please. Another outcome that we've had is that we've had over 20 communities across the region that are actively undertaking this lifelong community work. They're on-the-ground projects that are supporting this, such as community gardens. We have had some that have actually begun to diversify their transportation modes, such as voucher programs. We have about 12 transportation voucher programs where they either use volunteers or neighbors or pay people to transport about 800 people a year, and that program is growing. And then some of the other things you've heard about from the other communities, like walkability assessments that have resulted in street and traffic changes, have also happened, and making places more pedestrian-friendly. Next slide, please. One thing I want to say about the 20 communities we're working with is that we have really built a lot of experience on how to get projects done and what it takes to make it age-friendly by working in areas where we have momentum and where we've had engaged stakeholders that have shown interest to us. But we're now starting to look more strategically at equity and areas that are disadvantaged. So our next work is going to be taking these lessons learned and working in areas where there's a real need and where they may not approach us first. So talking about what's next, I want to go over a couple of things. One is that we have found that engaged stakeholder advocates are key for lifelong community work to happen. So we've embarked on a region-wide conversation on what it means to live longer, and we've really framed our message around longevity, not aging, because no one is really excited when we talk about aging. No one thinks they're doing it themselves. No one really wants to think about it. But when we talk about what does it mean to prepare for longevity, we are starting to get some traction. This work has been funded through GIA, through a very generous grant from the Pfizer Foundation, and so we appreciate that support for that. We have been testing this longevity message in different ways and using it to engage stakeholders. One way is that we are having community conversations where we engage and poll different audiences, ages, and different cultural groups on the subject. We also are doing a tactical urbanism project where we're going to actually transform 2 city blocks in June into a lifelong community where people can come and experience it, if only for a couple of days, what it would be like to have more connected streets, to have bike lanes, to have outdoor dining, to have more of those social type connections that are so important. And then the third way we're taking this message out is through a partnership with public broadcasting, where for 6 months we repeatedly air short vignettes of older people that we've taped in the community, talking about what it means to them to age in the Atlanta community. And then lastly, I'd like to share with you, next slide, what we're doing next. And we know that in order to build that momentum and to really get the attention of the cities and elected leaders that actually make a lot of the funding decisions, we have to have a story that tells the economic impact of older adults remaining in the region. And we're looking at that. I wish I had more outcomes to give you on this, but we're only beginning. And our research and analytics department has a model called REMI, which is I think fairly well known among planning agencies. And we're looking at the effect, some of the early findings that we know from this model is that when you attract older people to stay in your area, either new retirees or older people that have already been there, there is a real economic benefit. And it matters whether you're looking at it from the national level or the regional level. From the national level, having a larger older population can actually be a drain because you have a smaller tax base, and since Medicare, Medicaid, many of the older health care plans are predominantly federally funded, it can cost money there along with Social Security and pensions. But from a regional level, it's a real plus in that it can increase the income from the area when people are drawing the money out of pensions, especially if you're attracting people like we often do, being in a sunny place from other areas. It also contributes spending to the goods and services in the local economy. And then we know that the healthcare industry really benefits from having an older population, and along with the tech businesses that support the healthcare industry. And then they found that there's a increase in tourism with older people, and not the big trips like to Disney World, but the day type trips that people that are free during the day can actually spend and stimulate in the area. And then my last slide is just a summary of what we're trying to do with our lifelong communities. If you go to the next slide, we're working to create momentum to increase our funding and resources around these issues, and to target new areas based on equity. Thank you.
Thanks, Mary, and thanks to all of our speakers. We have just a few moments for questions, and many of you have written in, so let me just ask a couple of them. All of our speakers' information is available. One question that's asked by a number of you is, can you have access to the slides? Those are available if you send an email to info@asaging.org. So info@asaging.org. And I'll be happy to share those with you. As Steve also said, we will be having this entire presentation available on our archives probably in a week if you check back on the Grantmakers in Aging website. So the question, and I'll start with Alan on this one. You talked a great deal, and many of you mentioned the use of mapping to try to target your activities. Could you say more about that, and anything about the way in which people might get involved in this who may have not had professional expertise in this area?
Maps tell more of a story than statistical data to people who know a community, because when they see things on a map, they know other things in that neighborhood. So it's a very rich way of sharing information. Data can be, a lot of cities also are preparing and offering data in forms that can be easily mapped. Philadelphia, Chicago, it may be easier to manage in some ways than statistical data, because that kind of software is usually only used by statisticians. Complex GIS has to be done by a professional. We have an excellent one here. However, there are other options through ArcView. I can't go through all this right now, but if you contact me, I can give you other options in order to use that data that's usable. There's also census data that can be easily mapped. And that can really tell you a lot about your neighborhoods, and that can be important because otherwise it is difficult sometimes to know where you're going. PolicyMap is also a good online source. PolicyMap has various kinds of information. You have to pay for some of it, but then again, you don't have to hire a GIS specialist. But if you write to me, then really we can provide a lot more information about what kind of data is available, free, public, and ways of using it without necessarily developing GIS expertise.
Thanks. Very important issue. I'm going to return to a comment that Mary made in the last part, but several of you I know are working on, which is the whole issue of equity in providing these services. Most of these programs do start with the place that already has stuff going on, but that is almost never the neighborhoods that are most in need. So I wondered if any of you would like to expand on that issue around about how do you reach the kind of lowest level communities in terms of their socioeconomic status or health needs or other kinds of criteria? Anybody want to take that one?
Well, hi, this is Dana from Bowling Green. And so our strategy to do that was to really work through our neighborhood services division of the city in terms of being able to reach out to leaders in as many neighborhoods as possible that may not necessarily be folks that would think of the university as something they would connect with. And so we've tried to identify and recruit within those neighborhoods that we know are underserved or underdeveloped key mentors and actually recruit them into this the senior expert academy that we've been running for 2 years so that we can actually develop leaders within those communities. And that's, we think we're getting some payoff from that. It's a constant process of nurturing and listening and reframing ideas that make sense for that particular neighborhood, and it could be a small part of a neighborhood rather than the whole neighborhood. And it's, again, really being very careful and cautious about listening to what those neighborhood members want us to do and say that what they think is important versus what we might think from the outside looking in.
John, can I also jump in?
Sure. Go ahead.
This is Dory Block in New York, and I just wanted to say that our general strategy has been if we're going to seek new funding for an initiative or if we're going to give in-kind resources to something, that we are always prioritizing neighborhoods where there's the greatest need and, using data to make sure that we're accurately identifying that need. And then if neighborhoods or sectors of the city want to get involved because they have more resources and because they come to it on their own, we will support them. But that whenever we're actively choosing where to do an initiative, we always first prioritize the communities where the need is highest, and that's how we've operated up until this point.
Alan, did you have something as well?
In Philadelphia, what we've done is we've identified neighborhood organizations, especially like community development corporations, senior centers in distressed neighborhoods, people who are, living organization institutions and making them partners both in the work and in the research. So we did a design charrette. We did that with a Spanish-speaking community development corporation because they're the ones that would implement the changes that were suggested. And it was learning about the neighborhood through a community organization that's going to be there and works day to day with all the adults in the area and other children as well. That's allowed us to get into some of those neighborhoods.
Our next question, and I'm afraid probably the last one, is around funding. And since this is a funder audience, among others, I thought it would be a good one. In what way has additional funding, external to your governmental funding, from foundations or other funders been particularly useful in advancing this work?
This is Mary. I would happy to start out answering that. For us, it's been enabling us to take our message out. Those community conversations where we're actually reaching out into neighborhoods that wouldn't come to us, as previous people have said, has been very important in reaching our equity goals. And also it's helped us to do a big communications campaign with not only elected officials and other people that are in the audience, but with all ages of people that normally we wouldn't encounter in our work. So it's been important for us in that way.
Anybody else?
Well, I would just say that in Philadelphia, I had mentioned that we we don't have a budget for our effort, but if we were to have one, I think that idea of a communications campaign would be really, really helpful. We've been using this idea of empowering people to become aging experts in their own office or become aging ambassadors within their own office as our communication strategy, but I think if we were to have more funding, that would be really key.
At this point, I'm going to ask our speakers to give us their final summation comment. And so, Mary, I'm going to start with you.
I would just remind people that this kind of work takes a long time. It can't be just a project. It needs to be embedded in the work that people do every day, and that takes time, and partnerships and collaborative work is key.
Dana?
I would echo what Mary says. This is hard work, and it is also the most exciting parts of research that I've done and my colleagues have been participating in the past few years, because we can see that it makes a difference in the lives and the lived lives of our community. And so we feel very, very fortunate to be able to help nurture the continuing partnerships between older adults and our college students, and soon, we hope, our high school students in both the city and the county school system.
Alan?
We're looking at aging in community, and the key factor here is poverty for the community as a whole and for the older adults. So thinking about this as a community rather than just as older adults, thinking about the impact of poverty on all these outcomes is absolutely critical.
Okay.
I don't have too much to add, but I would say one of the most exciting pieces of our age-friendly effort to date, I think, is bringing together such different people around aging issues, innovate together, and find collaborations that are that people have never really thought about doing, but around aging issues. It's very, very exciting.
Dory, as the organizer of today's webinar, you have the final word.
So two things. One is that I think it's really extraordinary to see how age-friendly communities have developed over the past years. I've been doing this work for only 5 years, and just to see the number of places where this work has taken hold is really amazing. And to see the amount of progress that's happened in the communities that presented today is really exciting. And to know that now communities are beginning to be behind the curve if they don't have an initiative like this is really exciting. On the second note, I'm hoping that where we're moving is that maybe 5 years from now that we will have potentially some population level research or data to really demonstrate the impact of some of the work that we're doing. And I know how hard that is, and it's so early on in our work, but I'm hopeful that we can eventually get there, because I think it's necessary to bring this to where it needs to go in preparation for the aging of the population, which is going to, is affecting our communities now and is going to have a huge impact on our societies going forward.
I want to thank Dorian Block of the New York Academy of Medicine, Kate Clark and Alan Glicksman of the Philadelphia Corporation on Aging, Dana Bradley of the Gerontology Center at Western Kentucky University, and Mary Blumberg of the Atlanta Regional Commission for their participation in today's program. We thank you for all that all of you do to make life better for older adults. I also want to thank the John A. Hartford Foundation, the New York Academy of Medicine, the Community Agenda Initiative, and the Pfizer Foundation for their support of this program, as well as the American Society on Aging for their technical expertise. Please watch the Grantmakers in Aging website or your email for upcoming programs. We will be having programs throughout the rest of the year on a monthly basis. And finally, I want to say thank you to all of you who participated in today's webinar. Have a great day.